imagine casually walking through a city in Asia where every corner is surrounded by tempting fast food, yet there are only few places that encourage for physical activity. What used to be uncommon is now becoming the norm, as we all know, obesity. Did you all know that more than half of the adult population in some Southeast Asian countries is now overweight or obese? According to a report by casia.co in 2023, this data is based on the latest update from the World Factbook Central Intelligence Agency from 2016 to 2024. Over 50% of adults in countries like Malaysia and Brunei were classified as overweight or obese, and this trend has been consistently rising since 2016. What's even more concerning is that this number keeps growing every year, turning obesity into a major health concern across Asia. So, this issue affects not just individuals but also families, communities, and even national healthcare systems across Asia. The rise in obesity has become a public health concern that demands attention from both governments and citizens. As someone who has researched this issue through new articles and health reports, even academic sources, I want to share why this problem is growing and why we should all be concerned. Obesity is becoming more common in Asian countries due to lifestyle changes and it causes serious health problems. However, there are practical and effective ways to reduce this issue if we all take action now. So, let's begin by exploring the main causes of rising obesity in Asia. Many people in Asia are gaining weight because they are consuming fast food, sugary drinks, more than enough, and not getting any physical exercise. If this kind of lifestyle continues, it will surely contribute to an increase in obesity across the region. One of the main causes is the increased consumption of high calorie processed foods or junk food. Obesity is one of the main causes of type 2 diabetes and cardiovascular diseases, such as high blood pressure and heart attacks. These conditions often require lifelong medical treatment, regular checkups, and medication, which can be physically and emotionally exhausting, especially for the patient. Another major cause is a decrease in physical activity in daily routine. Life nowadays has changed according to how people live and work. Many people now spend most of their time sitting at desks and using digital devices, which means they move less. Now, most people use cars and public transport, and they walk or cycle much less than before. Now that all of us understand the causes of obesity, let's take a look at the effects it has on individuals, families, and society. As someone who has experienced being overweight, I can say that it seriously can affect a person's health and overall well being. Obesity increases the risk of chronic diseases such as diabetes and heart problems. It also places a heavy financial burden on national healthcare systems. For families, it can cause emotional stress, financial strain from medical bills, and even limit daily activities or family routines. One significant effect is the increased risk of chronic diseases. Obesity is a leading cause of type 2 diabetes, heart disease, and other cardiovascular conditions. These illnesses often require lifelong treatment, regular doctor visits, and costly medications, which can lower a person's quality of life. There is also an economic burden on healthcare systems. As the number of obese individuals increases, hospitals and clinics face more pressure to provide treatment for related illnesses. Governments are forced to spend more on obesity related health services, programs, and medications, which affects national budgets and resources. So, what can be done to tackle this growing issue before it worsens? Although the rise in obesity is alarming, there are steps we can take to reduce it. Public education, better food regulations, and encouraging physical activity can all help to reverse this trend. Health education campaigns are essential. Government can run campaigns to raise awareness about the importance of healthy eating and regular exercise. Schools and workplaces can also become platforms for spreading health messages and promoting good habits among students and employees. For government, they can introduce food regulations and policies, subsidizing the cost of nutritious foods like fruits and vegetables, making them more affordable for everyone. Encouraging active lifestyles is equally important. Cities can be made more health friendly by building parks, bike lanes, and fitness centers that give people more opportunities to stay active. Local communities can also organize sports and wellness programs to motivate people of all ages to move more. Now, let's now we recap what we've discussed and think about the steps we can take moving forward. In conclusion, obesity in Asia is becoming more common due to lifestyle changes as unhealthy eating and reduced physical activity. This growing issue has led to an increase in chronic health conditions and rising healthcare costs for many countries. To combat this, government should invest more in public health education and preventive measures that promote a healthier way of living. At the same time, individuals must take responsibility for their own health by making smarter food choices and staying physically active. Although the obesity crisis in Asia is not Although the obesity crisis in Asia is serious, it is not irreversible. With the right strategies, strong cooperation, and a shared commitment to better health, we can work together to reverse this trend. By making healthier choices today, we can ensure a healthier, stronger Asia for future generations. That's all for today. I hope you're enjoying listening to this. Thank you.